let's get going. Guess what we're going to talk about this morning? The sun. The sun. No, a new study came out. I was telling you, I think it's sort of National Study Week because there's been a lot of studies that have come out this week, certainly ones that I have flagged. I find them very interesting. And so this one here on melatonin. So now, here's what the study is saying, okay? We all know that melatonin, it's a very popular supplement, by the way, but a lot of people don't realize that your body makes melatonin, okay? So, and what they're showing in terms of sleep, here's the study, that melatonin supplements after a period of time don't work anymore. So generally, if you get, I always tell my patients, look, try it. If it works for you, good for you. But remember, I've been around for a lot of years, and I just found over the years, melatonin, it can get a person started, maybe on a sleep supplement, but generally I find it wasn't affected after a period of time. I don't know if your body gets used to the supplement or whatever. And secondly, I just find a combination of things that I like. There's certain herbs and things that I like better than melatonin over the years. I found to be more effective in terms of helping sleep. But let me just give you a little bit of the what melatonin is. First of all, it's a hormone, and your body produces it. I want to make a few suggestions to you today to get melatonin levels up in your body. These are things that are very important for you, because one of the biggest problems that we have, and melatonin, by the way, scratch my head here. Melatonin, by the way, is not just for sleep. Okay, people think of it just for sleep, but melatonin is a very powerful antioxidant. But remember, your body makes it. And your body makes it when the sun is out, okay? There's nothing better than sunlight. You know me, you're a human solar panel. You need the sun. Everybody needs the sun. Everybody needs the sun. Now, don't go burn in the sun. I'm not telling you to do that. But melatonin, especially the sun, especially in the morning, really elevates your levels of melatonin, okay? So the sun. And by the way, where's the best place to get the sun? For vitamin D? Your arms, okay? And your legs. Those are the best places. Those are your bigger solar panels, are on your arms and your legs, okay? But here's another one for melatonin, specifically for melatonin. Okay? So you heard it first at the Martin Clinic. One of the best receptors for melatonin, okay? Specifically for melatonin. Because sun gives you melatonin. It makes your melatonin levels go up. But eyeballs, you see these things? Okay? Getting the sun in your eyeballs. You know what, folks? Can I just make a suggestion to you? For about 20 minutes, if you can, don't put your sunglasses on, especially in the morning. Let the sun get into your eyeballs, okay? I'm not saying look directly into it. It's very bright this morning. There's very little, there's really no clouds out this morning. So it's bright, but you know what? Don't put your sunglasses on right away. A lot of people, the sun, they get used to it. But if you can, because these are just facts, the best way to get melatonin levels up, and the solar panels for melatonin, I'm not talking about vitamin D, because vitamin D is on the arms, and vitamin D comes into your eyeballs too, but for melatonin, the best is your eyeballs. Do you know that your eyeballs need the sun to, like I said, you got solar panels in your eyes. And one of the things it does is it produces melatonin. It makes that melatonin go up. So you get that in the morning, you get a better sleep at night. Okay? Isn't that amazing how your body works? Okay. And secondly, this is, okay, so in the morning, if you can, for about 20 minutes, keep your sunglasses off. Let that sun get into those eyeballs and get back to the solar panels in the back of your eyes. It actually produces melatonin. Now, secondly, at night, so isn't it amazing how your body works? Your body during the day wants vitamin D. And part of that is for your melatonin levels, okay? But at night, the darker, the better. So, guys, learn to sleep in total darkness, because the darker the room, no light, especially that blue light, you know, from an alarm clock or whatever, like, guys, this is really important. And what I've started to do, okay, and my wife has done this for years, is starting to wear a mask. Like, this is not my face mask. This is not my face mask for COVID. Okay, it's not. Okay, because today everybody's got, like, they're doing this, right? Well, this is not for that. This is for your eyes. Cover your eyes, because the darker it is at night, the more melatonin you bring in. You're producing melatonin to put you into that deep, deep REM sleep. And so isn't it, it's kind of fascinating, isn't it? Best place during the day for your melatonin levels to go up is when the solar panels in the back of your eyes get the sun. That's during the day, but at night, total darkness. So I don't know if you guys do it, but you might do this, okay? Like, start wearing, don't wear your mask at night, and then an eye mask, okay? 'Cause you may die of carbon monoxide poisoning if you don't breathe out. Don't wear a mask. If you're wearing a mask for COVID, don't sleep with it, okay? Anyway, I find it funny how the world is, you know, it's amazing to me, okay? And I just got to make a point, and then you guys can come at me. I don't care. I really don't. I just got to tell you, if this virus was so serious, okay, they closed the whole world down, but then the protesters, even in Canada, all over Canada, have been out on the streets protesting. Well, what happened to the virus? Like, either the virus is going to kill us or make us very sick and overwhelm the hospitals, or it's not. Like, you know, you can't pick and choose. Like, I don't understand it. Like, why is Doug Ford, why is Trudeau, why is Trump or whatever, why are they allowing people in the streets? Before you couldn't go. Like, you got to be 6 feet apart. You got to be wearing a mask and blah, blah, blah. And now, jeepers, they thrown it all out the window. Oh, yeah, you can protest. Well, what do you mean? I can't bring my grandchildren to go play baseball, but I can go protest in the street, and I don't have to practice social anyways, no more politics. It just look, guys, you know me and the virus. I'm not the virus. I'm more interested in your immune system. Anyway, and by the way, part of that immune system is vitamin D and melatonin. Okay, so I just thought I'd bring you that study that came out. And the headline of the study is melatonin supplements are not effective in the long term. And again, they're not going to hurt you. And I got no problem if you personally get results with melatonin. I got no problem with that. Okay, good for you. But for me, I found that the sun, when it's out, we're getting a beautiful day today, and darkness at night, okay? The real dark. So again, you might invest in an eye mask, not just the facial mask, okay? For COVID. So that study on melatonin, let me bring you a couple of, a new study out, just I'll go fast on this one. CRP. You know what CRP is? C-reactive protein. And again, we've known this for a long time, but a new study came out confirming that it is probably the best test to find out if you have inflammation in your body. So I often tell you guys, you know, if you don't ask, you don't get. When you're getting blood tests done, let's say you're going to see your doctor, just going to get some blood tests done, you know, make sure there's a couple of tests that, you know me, I talked about this every day, just about make sure they're taking, generally they'll do this routinely, especially if they're interested in your lipids. If you're getting your blood work done once a year or whatever, they're going to usually do this. They'll get your triglycerides, your HDL, and those two things tell Dr. Martin lots, okay? Those two tests. Those are the two tests. When you send me blood work, I'm going to look at those two things. Those are the two ones I'm interested in. More than anything else, that's what I'm interested in. Now, CRP, C-reactive protein, is an inflammation test. And unfortunately, okay, medicine in general has sort of forgotten about this test. They don't take it routinely. They do it if they suspect that you have rheumatoid arthritis or an autoimmune disease. But this test should be taken routinely because it can tell you years ahead of time. Remember now, let's just talk about this for a second. Inflammation. Inflammation, it's a good guy and a bad guy, okay? It's a double-edged sword, okay? It's on your side, and then it's not on your side. It's on your side if you have an infection. Inflammation, it's more blood supply. You get a rush of enzymes and cytokines and healing, right? And your immune system goes into craziness because you got a bug coming at you or a virus coming at you, and your body fights that. That's the good guy. If you punch me in the arm and I rub my arm, right? What am I doing? I'm bringing extra blood supply and heat, inflammation to the area of injury, and it's good for you. It brings the ambulance. Your body has a natural ambulance system, okay, to fight infection, to fight injury. And that's the good guy of inflammation. The bad guy of inflammation is when that inflammation doesn't go away. And a lot of people think of inflammation as pain, and that can be true, absolutely. You got joint pain, you got muscle pain, that is inflammation, okay? If it's chronic, the problem with this inflammation, if it's chronic, inflammation will destroy the same, you're rubbing your arm to bring, but if that extra blood supply and the enzymes and the cytokines and all the things that your ambulance brings to you, if it stays there for too long, you know what happens? It starts to destroy, first of all, your blood vessels. And that's why when we talk about heart disease, you don't hear me talking about cholesterol. Other than you can see steam coming out my ears because I'm not big, you guys know me, I'm not big on cholesterol. It's blaming the wrong, it's blaming the police because they're at the crime scene. Okay, it's not the bad guy. The bad guy is inflammation. And those cytokines, when they're meant to be temporary, but if they're there for a long time, now they start destroying. And we even talked about this yesterday maybe the day before, when we talked about nitric oxide. it starts to destroy the endothelial layer of your blood vessels. That's what starts atherosclerosis. And then it starts to calcify. But you don't even know that's happening. Do you know how many people have had a heart attack and then they get to the hospital, or if they have chest pain, they get to the hospital and they get an angiogram done, and the doc comes back and says, oh, you got 99% of your your blood vessels into your heart are blocked. And before, you had no symptoms. Maybe a little shortness of breath, or, a lot of people don't have any symptoms. But if they had done the CRP, if they had done the C-reactive protein, there was a study done, this is years ago, but it's been confirmed, that if you do the CRP test, you can tell up to 7 years ahead of time whether you're going to have a heart attack or not. This is a very preventative test, the C-reactive protein test. And like I say, by and large, the vast majority of people that send me their blood work for me to analyze it, just let me look at that. And I got no problem doing that. I'm happy to make my comments on it. But what I'm saying is, the vast majority of them, they don't have their CRP done. Now, if I look at, I'll come back to a little yesterday's discussion. If I look at your triglycerides and your HDL, I can tell you if you have inflammation. I can tell just from those two numbers. But the more accurate one is the CRP, C-reactive protein. So guys, you know that commercial in the United States, well, almost every commercial in the United States, when it comes to the drug commercials, we don't have them in Canada. But in the United States, you have them. The pharmaceuticals can advertise, and usually it's around the news at night, 6 o'clock or whatever. They do. They advertise a lot, and they say, ask your doctor if this medication is good for you, right? It's kind of funny, because I go, what do you mean ask your doctor? You don't ask your doctor if this medication is good for me. Your doctor knows what medication is good for you, right? But the pharmaceutical companies are not stupid. They know that puts a lot of pressure on the doctors to prescribe medication. I mean, guys, you got to give the pharmaceutical industry credit. They're not stupid. They got geniuses in marketing. And the classic example of that is how many people are taking statin drugs. The number one selling drug of all time is Lipitor. And they take it. Well, it's because the pharmaceutical industry push and push and push and push and push. Anyways, all I'm saying is, when you see those commercials and it says, ask your doctor if this medication is good for you, you know what's better? Is ask your doctor to do certain tests. If you don't ask, you won't get it. Now, sometimes they won't do it. And they should, but sometimes they don't. But all you can do is ask. A lot of doctors, okay, all I got to do is do a little tick mark on the requisition. So ask. Here's what you ask for. CRP, C-reactive protein. According to this study, it has again been confirmed. It's been around for a long time, this test, but it's been confirmed that it is the best test for inflammation. Now, there's other ones. Your fibrinogen, you can look at that. Homocysteine, those are other tests. If the doctor wants to get into like other tests and go into a more detailed test panel. I like that. The more detailed, the better it is. But anyways, all I'm saying is, you see, the C-reactive protein, guys, is a tremendous test. It's a tremendous test to show you if you have inflammation, silent or otherwise. And it's the silent one that is the deadly one. Let me tell you how C-reactive protein came about, by the way. Okay? C-reactive protein is an enzyme that's made in your liver. But your liver, you know, I love talking about the liver because I'm telling you, when I talk about the liver, every day I think about, you know what, Doc? Talking to myself, the liver, the liver, the liver, the liver. Almost all your hormones are made there. You know, your liver is such an important organ. We don't think about it very much, but we should. And especially in this day and age. Remember yesterday we talked about fructoholism in children. Imagine fructoholism in children. You're going to kill them. Going to make them very sick. Anyways, the C-reactive protein, guys, isn't that interesting about that test? Get that test done. Whenever you can, ask your doctor to do the CRP. Now listen, here's the numbers. Anything over 3 is inflammation, okay? Anything over 3, but I like it under 3. I like it to be at 0, that you have no inflammation. If 1, okay, you're all right. 1 and under, it's pretty good. 2, you're starting to get damage to your blood vessels. And 3, you are damaging your blood vessels. It's more advanced. So that's what I look for, guys. And I don't care about the normal range, because the normal, if it's under 3, it's normal. But that's not true. It's not. Because CRP, you want to really, and remember about inflammation, it's not Houdini. I always say that. Inflammation is not Houdini. Inflammation does not come out of nowhere. And the primary cause of inflammation is your insulin. Insulin resistance. When your cells become resistant to insulin, you create an inflammatory response in your body. So that's very significant. And there's a test that you can actually get done. And if your doctor flags it, it'll give you lots of good information about how your body is. And this is why I love the reset, guys. What does the reset do? What does the reset do? Reset, it lowers your CRP. It lowers your CRP, your C-reactive protein. I've proven it to thousands of patients over the years. When they cut out their crappy carbohydrates and their sugars. And I love the reset because it's a 30-day program to get your inflammation down. It's amazing. The results we get with that. Because it lowers inflammation. You lower inflammation, you lower your risk of a heart attack and stroke. You lower your risk of Alzheimer's and dementia. You lower your risk of cancer. You lower your risk of cancer. And then fourthly, you did I say Alzheimer's? Yeah, I said it, for your brain. You lower the inflammation in your brain. You lower the inflammation, guys. It's so, so, so important, okay? So, and even for diabetes, diabetes, we know what causes it, right? We know what causes diabetes. Carbs. You cannot become a diabetic. It is impossible to be. I'm not talking about type 1. I'm talking about adult onset diabetes. But it is impossible to become a type 2 diabetic without you being a carboholic. It's impossible. You're a sugarholic, carbaholic. 100%. No exceptions. Okay. Do I got another study here? Yeah, we got time for one more. Okay, so we talked this morning about melatonin. The sun. We talked about sun in the morning, darkness at night. The complete opposite at night. No light, guys. Dark, 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 dark. You make melatonin while you're sleeping. You're making it while you're sleeping. As long as there's no light coming in. See, you think, oh, I got my eyes shut, there's no light. No, there's light. Complete darkness. It's great. to know that. And then we talked about CRP, the C-reactive protein test, that again has been confirmed this week is probably the best test that you can have for inflammation to find out if you have the good guy or the bad. Remember, inflammation, it's good, then it's bad. It's good, then it's bad. And then thirdly, let's talk about vitamin E. What is vitamin E on the Martin Clinic alphabet? Exercise. I just got to bring this out because a study came out again. I don't know if it was National Study Week. All these studies came out. But here's one on breast cancer and exercise, okay? Breast cancer and exercise. Now, let me just say this before. Ladies, hello, I'm talking to you ladies. It's Kenny Rogers, ladies. Ladies, listen. Two things make breast cancer grow. Two things. The womanly hormone estrogen and insulin. That's a food hormone. And you know all about it. Well, two things make things grow. Estrogen and insulin. Now, estrogen is influenced. You're a woman. You need estrogen. And I don't care how old you are. You still need estrogen. It'll go down in menopause, but it doesn't matter. You still need it. But you don't want too much. You don't want too much. And xenoestrogens, chemicals. Look in your house and see how many chemicals you have. From plastics to, from pesticides to herbicides to cleaning products. Look at all those things. They all look like estrogen to your body. So that's very important. Now, so two things increase your risk of breast cancer. Estrogen, and this is why I don't like the birth control pill. Be careful. This is why I don't like, when they give you hormones. Look, ladies, you know me. I'm on your side. I want you to feel good. I want you to look good. I'm on your side, okay? So take this, what I'm saying is, like birth control, because people ask me, Doc, what should I do? And I'm not telling you not to do birth control, like when they give you estrogen. I'm not saying that. But you know what? They often put young ladies on birth control because their periods are so bad. But that's a Band-Aid. That doesn't fix it. It just regulates it. But it's a Band-Aid. And then in the long run, you're making them much more at risk of breast cancer. That's just a fact. Anyway, what this study is showing is that vitamin E, exercise, okay? Listen to this statistic. It decreases your risk of breast cancer by 50%. Exercise decreases your risk of breast cancer by 50%. Secondly, exercise decreases your risk if you had cancer, breast cancer, by 55% if you exercise. And I'll talk to you about this in 1 second, just what is the best exercise. I'll go over that with you. But any exercise is good. Any exercise is good. There's just some that are better, and I'll talk to you about that, okay? You have a 55% less chance, if you've ever had breast cancer, of it coming back if you exercise. 55%. Okay? And listen to this. If you exercise and you get breast cancer, okay, because maybe your insulin is high, you can't out-exercise a bad diet. I've talked to you about that, okay? And maybe you got estrogen dripping off of you, ladies, okay? And then you get a breast cancer. But if you exercise, vitamin E, 70% of women who get breast cancer who exercise won't die from that breast cancer. So the advantage of exercise is legion, guys. It's so important. Vitamin E. Now, what's the best vitamin E? What do I do, doc? Okay, here's the best proven. All exercise is good. Go for a walk every day. Take your dog out for a walk. Exercise. Just move. It's good for you. You'll never hear me tell you differently. It's always good to exercise, any kind of exercise. But here's the best, ladies, for you. Okay? 15 to 20 minutes of intensity training. Okay? 15, 20 minutes, 3 times a week. You don't have to do it any more than 3 or 4 times a week. Move every day, but 3 or 4 times a week, try and do this if you can. Okay? Try and do this if you can. More of an intensity exercise. You know what I do? I have my phone, and I have a thing called Gym Boss, the app. And I go downstairs in my little homemade gym in the basement, and I put Tabata on. Tabata, not Tabata. Tabata. And it's, Google it and look at it. It was developed by South Korean speed skating coach. And he found it was the best exercise in terms of endurance and training, and it's called Tabata. Now, Tabata is 4 minutes long, okay? 4 minutes long. And your phone actually rings, so you work hard for 20 seconds, and I recommend, ladies, weights or pull, what do you call them? Not ropes, but come on. I've got a brain fart in my head today. Like this, okay? Like the bands. Oh my. Okay, the band. So tension bands or whatever, go hard. 15, 20 seconds, and then the thing goes ding, and you get a 10-second rest. And you go 15 seconds, and you can do squats. I do kettlebells workout. I do anything, like even if just weights with the arms and that 15, 20 seconds hard. Or you can, you know what I like too? Here's a good one. The trampoline. Okay? The rebounder. That's so good for you. That's good for your nitric oxide too, by the way. So 15, 20 minutes, like you can do that Tabata 3 or 4 times if you want. And intensity. And ladies, especially for you, weights, okay? Try and do the weight resistance, okay? That, start with light and then go a little bit heavier. You need that strong muscles to have strong bones. And it decreases your risk of breast cancer. And if you've ever had breast cancer, it decreases your risk of it ever coming back. And they've shown that exercise vitamin E, the true vitamin E, it will help you not to even die from breast cancer. It is so positive. Move. And if you can, do intensity training 3 or 4 times a week. That's the best. They've proven it. Okay? I don't care if you go on the treadmill for an hour. They've shown that's catabolic. It's not anabolic, it's catabolic. That breaks your muscles down. Do some training, ladies. Some ladies don't like weights. I know it, I get it. But do the bands then. Do the bands. It doesn't have to be heavy weights. Do resistance exercises. They help. And if you can do it at some intensity, even better. Okay, so those are the 3 studies we talked about today. Now at 10 o'clock, if you don't get our emails, you have a link to come and join Tony Jr. and I and Brandy this morning on a radio show format like live, okay? A radio show format like live at 10 o'clock this morning, okay? So ask any questions you want. You got the brains in the family sitting there, Tony Jr., and you got the old guy sitting there, okay? And we're happy to answer your questions. We love doing it. We do, okay? Remember, we did a radio show for 20 years, okay? I'm used to it. I had my own radio show for 20 years. Remember that. So This is just, it's sort of a continuation of our radio show, okay? And so is this, by the way. And so, okay, so, and if you, tomorrow, I might finish the studies, depending on how many questions I get tomorrow that we don't answer today. So usually it's Friday is question and answers. If you have questions and you can't get on today, send your questions in. We'll try and answer them tomorrow on question and answer. But I do have a few other studies I wanted to talk to you about. But hey, I ain't going nowhere. We're still locked down. Oh, anyway, love you guys. Talk to you soon.